Hello, my name is Margie Traylor, and I am the CEO of Walk a Mile in My Shoes. This company was built on the premise that empathy is a core driver of behavior change, and if you can get someone to stand in someone else's shoes, feel with his or her heart, see with his or her eyes, you can make the world a better place. It is our mission to improve patient experience through creating patient centered, empathy based training for clinicians and support staff. These experiences are designed to create an emotional response that becomes a catalyst for behavior change and is incorporated into a patient experience improvement curriculum. The problem is a big one that is tied to value based purchasing, which was introduced with the Affordable Care Act through CMS. Over 3,000 hospitals nationwide are subject to value based purchasing, which subjects those hospitals to penalties or incentives tied to the quality of care. Given that, hospitals are motivated to improve their performance to maximize their reimbursements. CMS designed value based purchasing to pay providers based upon performance to improve the quality, cost, and access at the hospital level to healthcare. The program is focused on four key domains, including the clinical process of care, patient experience scores, outcomes, and efficiency. In 2016, the potential incentive or penalty for CMS hospitals was $1.5 billion. Commercial payers are instituting similar programs with significant financial implications for hospitals. In 2016, United Health Group paid $148 million in bonuses to 1,900 care providers in their Medicare Advantage Performance Program PATH. In both programs, up to 25% of the performance incentive or penalty is attributed to patient experience measured by surveys of patient satisfaction. The average Medicare penalty for the 1,500 hospitals impacted in 2016 was over $1 million, and 250,000 of that was directly tied to patient experience scores. That is a serious challenge, or how I like to think of it, as a serious opportunity for us and all 3,000 hospitals. We, of course, see this shift to value based purchasing as an amazing opportunity to help hospitals achieve top ratings and bottom line performance in an industry that is under significant financial pressure. The patient experience problem has the right economic incentives to make it a top priority for 52% of U.S. hospitals. We are seeing that 59% of U.S. hospitals have budgeted money for education and training to accelerate patient experience performance. There is a $1.5 billion opportunity at stake to improve patient experience in Medicare alone, and that's what we're here to seize. Our solution is the most innovative, efficient, and effective way to create empathy and advance education of healthcare workers through the use of virtual reality. By training multidisciplinary healthcare teams on the job in 3-minute segments on patient and family member communication and evidence based clinical protocols, we drive improvements in patient experience and outcomes. Let me describe how this works. In the virtual environment, the clinicians can choose their avatar to be the patient or the caregiver. It teaches them by watching themselves interact as a patient or as a clinician in real life. The technology simulates the physical environment through rich 360-degree immersive videography. The learner has the opportunity to transport themselves through interactive selection to various scenes with the patient. This gives the learner risk-free training that they can practice over and over again to master their skills. Their humanistic skills and clinical skills grow over time through modules that are both fun and competitive. We integrate a leaderboard and gamification into the overall curriculum to drive engagement and competition amongst the staff. And all of these modules qualify for continuing education credits and get automatically reported to state licensing boards. The impact of this approach is clear. Our pilot and the early results indicate that patient experience scores improved 10% over the benchmark and employee engagement is up in just 30 days. This solution promises to reduce employee turnover, increase employee engagement, improve patient experience, and outcomes. This translates to improved bottom line performance for the hospitals we serve. This is a no-brainer. The business model is built on a licensing fee structure with annual contracts and recurring revenue. In year one, we will build 8 modules, including the pilot. The modules will be built in priority order based upon the worst performing service lines reported by CMS. The library modules will grow each year as money is reinvested in expanding the library of training modules to make it more valuable and sticky to improve customer renewals year over year. We believe that in year one alone, we will contract with 100 hospitals at $25,000 each in licensing fees. In the first 3 years, we expect to license our library to over 300 hospitals at $10 million in annual recurring revenue. By year 3, we forecast that operating profits will stabilize at 55% annually. That's a pretty good bottom line. Our team has deep expertise and passion for healthcare. We will start with a small crew of 5 plus our production partner SiteWire. This team includes me as CEO, Katie Marty to drive the evidence-based practices integration in the training curriculum, Christy Cole to develop the metrics and protocols for improving patient experience, Gabriel Ramirez to develop and implement the go-to-market strategy and sales team, and Steve Koch as our human-centered design expert focused on engaging patients and caregivers in defining the ideal patient experiences. This is an all-star team of seasoned healthcare executives that have a track record of getting the job done and making. This is the timeline for year one. Assuming you fund this venture, we expect to exit year one with $2.5 million in annualized revenues under contract and a library of 8 modules with 8 more. This business is ready to go. We've got our first pilot rolling. To finish this pilot plus 7 more modules, we require $433,000 in capital investments for equipment and production cost. On top of that, we need funding of $538,000 to cover a half year in operating expenses to get the business off the ground. Our ask is that you invest $1 million to cover the operating expenses and 100% of the capital investment. For that, we're willing to give you a 25% stake in the company and return to you $2 million or 116% over 3 years. Are you ready to walk a mile in my shoes to make a mountain of money? Thank you.